Well, the Prime Minister must account for official figures showing that 10,000 unexplained deaths happened last month in care homes in England and Wales. The challenge was made by the Labour leader, Sir Keir Starmer, who said that the UK government had been too slow to protect people in care homes. Boris Johnson announced a further £600 million to improve infection control in care homes in England. The latest official figures show that in the last 24-hour period, 494 deaths were recorded in care homes, in the community and in hospitals in the UK, and that brings the overall total to 33,186 deaths, which are linked to coronavirus. Our political editor, Laura Kuenssberg, has the latest.
Were the places that provide homes for the vulnerable and elderly ready for this crisis? Are they coping now? Some managers fear they're being asked to take too much risk. Hospitals requesting they take in elderly people who've tested positive with the virus.
We've refused them, and I know a lot of other homes have refused them. It's very hard to control. So why on earth would they ask us to take people who are positive with the virus in a care home?
The government says there isn't the evidence that's happening on a widespread scale.
Sir Keir Starmer.
But the Prime Minister facing the simple accusation. The risk to care homes was seen too late.
Until the 12th of March, the government's own official advice was, and I'm quoting from it, it remains very unlikely that people receiving care in a care home will become infected. Does the Prime Minister accept that the government was too slow?
It wasn't true that the advice said that, and actually we brought the lockdown in care homes ahead of the general lockdown.
The advice till mid-March did say it was very unlikely, but Number 10 accused Keir Starmer of quoting it out of context. But is the true agony of care homes known, with so many lives lost?
10,000 additional and unexplained care home deaths this April. So can the Prime Minister give us the government's views on these unexplained deaths?
We are seeing an appreciable and substantial reduction, not just in the number of outbreaks, but also in the number of deaths. Solving the problem in care homes is going to be absolutely critical. We must fix it, and we will.
There's a promise of another £600 million to help in England.
Why is it that the government can't seem to get a grip on the crisis in care homes?
Well, I don't underestimate the challenge being faced by residents and staff of care homes. The package of support that we're giving today builds on the work that we've been doing for many weeks now. There is more that we can do, and our whole focus now needs to be on ensuring that care homes are guided through.
As each day passes, though, the disease claims more lives. Betty Ball was 95 when she passed away in care in Kidderminster.
Very, very hard. As I say, she'd had dementia for 15 years. She'd lived with it. We saw each other every day, and then suddenly for that to disappear, and the guilt for us, really, guilt for me in not being able to see her and support her.
Her daughter will lay Betty to rest tomorrow. Just one of so many families changed by this disease, the virus that is altering our country too. Laura Kuenssberg, BBC News, Westminster.
The number of tests being carried out for coronavirus is still below the government's target of 100,000 a day. Yesterday, 87,063 tests were carried out. Some key workers are also reporting difficulties and delays in getting test results. And today, Jeremy Hunt, the former Health Secretary, said the priority should be to get test results back within 48 hours. Our health editor, Hugh has the story.
A drive-in coronavirus testing centre today. Essential workers waiting to have nose and throat swabs taken.
I called GP and they said it's not possible to test. So we are coming now, and he had temperature yesterday.
I booked it online. I just do a test on Google. Then it took me to a government website where I got the link direct. So today, actually, I booked it 2 hours ago.
The process of booking tests and having the swabs taken seems to be working relatively smoothly. The results should be back within 72 hours, but we're hearing some reports of people waiting quite a lot longer. As well as drive-in testing, there are home test kits which can be booked online. One user told us she waited 9 days before her family's results came back, but not hers. Nobody could tell her what had happened, and then she found she couldn't get a second test.
My anxiety levels were raised. I felt disappointed because I felt that nobody was somebody had to be accountable. When you go on the DirectGov website, it recognises you've already had a test. So I couldn't do that.
The government's target for the end of April was 100,000 tests provided daily. Since then, the number's only occasionally been back above that. Yesterday, it was only just over 87,000. The government says it wants laboratory capacity to handle 200,000 tests daily by the end of this month. But there's a warning that more needs to be done to ensure they're processed quickly.
If you're trying to track down and quarantine anyone who has the virus, you really need to have the results of those tests back in 24 or 48 hours. If you've got NHS staff who are going into work every day, again, you need those results back very quickly. And that's the operational issue that now needs to be addressed.
Ministers have said a testing and tracking system will be in place in the middle of this month. That's a big ask, and there's clearly some work still to do. It's a crucial part of the plan to keep the virus in check. Hugh, BBC News.